All right, well, we didn't have any farmers markets to go to, but there are quite a few events going on here in Moscow. And I think for the better part of 4 or 5 months, my husband and I were at every event. We would go from a canvas here to a basketball game to like Bangladeshi food night at the Pittman Center to back here for a drag show, and we were just everywhere. And it was amazing because you got to connect with so many people. And the thing I'll say about that, and it parallels the experience I have when I go door knocking, is that sometimes it can feel really polarized in this current political climate. But being at all these various events and talking to people about healthcare, talking to people about their neighbors, and how expanding the Medicaid program will not only benefit their economics, but also their neighbors' health, you really realize how good people are. And how there's so much more that connects us than divides us. So I think when we actually finished the petition drive, as exhausted as we were, my husband and I heard this from some of our volunteers too, we kind of all had like withdrawals going through that process because it was just so energizing getting out and talking to folks. So go ahead. That picture, God, there's like over 100 volunteers in that picture. So we had gotten to where we had qualified like 16 districts, and it was the last weekend of the petition drive, so of course I have more gray hairs than I did when we started the petition drive. But that picture was taken in Canyon County. We needed to get 2 districts in Canyon County over the threshold. And what I love about that picture is that there's not only folks from Ada County and Canyon County, but as I look up there, I can recognize volunteers that drove over from Idaho Falls, Twin Falls, Haley, down from McCall, down from Lewiston. People came from all over the state, and that was our experience here too. Moscow was, we were really blessed to get over our threshold pretty quickly here. And so then we were able to mobilize and send volunteers, and we'd go up to Coeur d'Alene for a day and canvass with volunteers, and we'd go down to Lewiston and make sure that we were able to get over the threshold in those various districts. So, go ahead. And this is a bipartisan issue. I know you'll recognize one handsome gentleman in this room in those pictures. So, of course, you have Tom Lamar and Dave McGraw up there. This, cancer doesn't care if you're a Democrat or Republican or independent, And when we go around the state and we talk to people about this issue, there's so much bipartisan support. I used to work in Orofino, so 75% of Orofino voted for Trump. When we go down there for events, at least 75% of the people that we approached enthusiastically sign the petition and say, oh my gosh, this is me, or this is my grandma, or this is my neighbor, this makes so much sense, I can't believe we haven't done this before. So I want to, it would be easy to see some yahoos driving around in a green camper and just think, this is like some wacko liberals, but this is absolutely a bipartisan cause. Not only, again, obviously you have David Tom up there. We also had the precinct committeeman down in Lewiston helping gather signatures, and he's calling all of his Republican friends and getting them on board. We'll talk a little bit more about endorsements when I explain what Idahoans for Healthcare is, but we also have quite a few Republican legislators that support. Okay, you're good. No, don't worry about it. So, obviously, spoiler alert, you all know how this story ends. We did it. We got, not only did we get, so the total number of signatures was 56,192. In the end, we got over 74,000 valid signatures, which is amazing. The cool thing to me is we got over 114,000 raw signatures, so that's a lot of support for this cause. We also didn't just qualify 18 of 35 districts, we qualified 21 of 35 districts. So here we are back out in front of Mingles where it all began. So this is the turn-in day at the Capitol. Oh man, I'm so pregnant. So that's Luke and myself in the top right. I was about 38 weeks pregnant, so I was down in Boise against the advice of my physician. But we had this amazing, it was so cool to see the fire line of all these boxes getting turned in, and every volunteer that was a part of this, that was able to make it that day, got to touch all of the boxes that came in. I think there's a picture of me. Yeah, so you can see all the boxes stacked up. We got signatures from every single district. And one thing that was so lovely to me was I would come home from work and I would just have an envelope waiting for me from somebody I had never met before. Maybe somebody down in like Madison County that had just found out about Reclaim Idaho, had taken it upon themselves to print out the petition and go out and get signatures, you know. So obviously all of those signatures made a difference, and it was really amazing to see that this movement had become so much bigger than any of its parts, you know, that people were just grabbing onto this and getting involved. It was also around the turn-in time in July that we officially kicked off Idahoans for Healthcare. So I co-chair the organization with Christy Perry, who is a Republican representative. And Idahoans for Healthcare, as you can see, is a coalition of healthcare providers, business leaders, community organizations, et cetera, all kind of stakeholders in this. We have gobs of endorsements. I'm not going to read all of them. Obviously, there's the notable ones that you would anticipate being up there, you know, the Idaho Hospital Association, the Idaho Medical Association. But to me, when I think about health, again, coming from my background, when I think about health, I think about more of that public health perspective. And so to me, the endorsements that make a lot of sense, and I'm excited that we have, are the Sheriff's Association, the Idaho Education Association, and I actually have a couple of great quotes from them. And every time I'm at an event, there's obviously security there, and the police often approach me and say, "We are so glad we're doing this. I can't tell you how often we see people just stuck in this cycle." So they said, obviously you can read it, by expanding coverage to low-income people with health issues or mental health issues, they're more likely to contribute to society rather than end up back in the system. One thing to note is 60% of inmates have mental health issues. When you leave prison, they give you a 30-day supply of whatever prescription drugs you're on, kick you in the tush, and off you go. I don't know anybody who can get their life together in 30 days. If you can, my hat is off to you. But you can understand how people would get back in that cycle after 30 days, unable to get their prescription, unable to get, you know, prescriptions are expensive, so who can get insurance in 30 days? So anyway, so that speaks to me to this like systemic problem we have of not treating people. And then you think about, you know, the recidivism rates and how increased those are. Again, the bottom one obviously speaks to my heart because of working kids and working in the schools. Healthy families are essential to a student's academic success. I think that speaks for itself. So, where are we now? Well, we bought another Medicaid mobile. That was exciting. This is the Vote Yes Medicaid Express. And obviously I'm being a little bit glib or a little flippant about it. But what's exciting to me is that we have that much more of a reach. So my husband and I have one Medicaid mobile up here, and then we have this one in southern Idaho. And obviously it's kind of a mascot. It's also been a great way to get earned media everywhere we go, but it also is a way to really bring out volunteers and get people really energized about this movement. So we often use those when we are doing canvassing events, and that I have this image up there just basically to demonstrate that like what we're still doing is what we've been doing and what's been successful. And that's we're out, we're talking to voters, we're connecting with people and making sure they understand the facts about the Medicaid expansion and how it will benefit them. So we got a picture here, just right up the stairs in Friendship Hall of one of our canvassing events that was just a couple weeks ago. We do door knocking canvasses, phone banking, we were at the fair, which was lovely. I think this is an image from the fair. This woman's daughter, again, you could read it. She has MS and no insurance. So, pretty heartbreaking stuff. One of the blessings of this campaign has been talking to people about their healthcare and about their experiences. And obviously healthcare is an incredibly intimate experience for people. And so I really feel fortunate to have been in the position to talk to people about this, because when you ask people about their healthcare, again, that's a fairly vulnerable topic. So for this woman who I'd never met before to be willing to share this stuff with, I'm really grateful. So Medicaid expansion by the numbers in Idaho. So 62,000 Idahoans will have access to health coverage. Somebody asked me the other day, where do they get that number? When we started, it was 78,000 Idahoans. Now it's 62,000. The only problem for us now is that we have 78,000 on the back one of the Medicaid mobile. So they get those numbers from extrapolating from SNAP benefits. So they can go through those to determine the number of uninsured folks. So we'll bring back $400 million of our own federal taxes. So right now, we're paying the federal taxes for the Medicaid program. That is going to other states and not coming back to Idaho. And like Dan mentioned, to pay for people who are uninsured, then we have the catastrophic and indigent funds. So if we were to expand the Medicaid program, 90% of it would be federally funded, and that 10% would be absorbed pretty easily by the indigent and catastrophic fund savings that we would see. At least 5,000 jobs will be created, and those aren't just in the healthcare sector. That would also be, suddenly if in St. Mary's they were to hire an OB and reopen their OB department, that person's family would be going out to dinner, they'd be getting haircuts, they'd be getting oil changes, so you can kind of see this trickle-down effect of having more providers and just a more flourishing economy. Rural hospitals and clinics will be able to stay open. Like I mentioned, I don't know if you guys knew that St. Mary's just had to close their OB department. As a woman who just gave birth 2 months ago, I can't imagine driving over an hour while in labor to get to Coeur d'Alene, or an hour and a half to get down here. So that really changes folks' quality of life. 33 other states have expanded and seen the uninsured rate drop by at least 40%. A study by the Idaho Center for Fiscal Policy shows that we would be saving around $15 million a year here. And if you were at the candidate forum today, you heard that Latah County would save at least $500,000 a year in indigent funds.
You all have a summary of that.
So obviously the previous slide was what we're predicting would be happening. So it's important to look at those other states that have expanded. To me, Montana is a really good test case because Montana is a pretty similar demographic to us. When they expanded, they covered about 79,000 Montana residents. They saved $22 million in the state fund in the first year. The thing that this picture happened by chance. We were driving a Medicaid mobile to my father-in-law's house in Kalispell, and we broke down in Libby. And I have to say, when we were on tour the first time, you stop at restaurants and you stop at gas stations, and we would talk to servers and we would talk to gas station attendants. Do you have health care? What's your experience like with health care? Overwhelmingly, people did not have health care. And you saw some of the stories that I posted earlier. People live with this anxiety, they live with this desperation. What do I do? Do I set up a GoFundMe page? Do I divorce my husband? How do I get health care? So to me, it's really fascinating just to look. So when the Medicaid mobile broke down, we'll have time for questions at the end if you could hold it. Yeah, just because I have a bad memory. So we broke down in Montana, and I said to myself, I'm not going to just sit here and nitpick my husband's attempts to fix Medicaid mobile. I'm going to go inside and talk to these folks, knowing that they have expanded Medicaid. And there was just a different energy around the folks that you would talk to there. There was just this levity that they had. One woman said, well, I hadn't had to use it, but I'm glad to know it's there. The other one said, well, I get an annual checkup now waiting until something was really, really wrong. And none of them had this crippling, well, fingers crossed nothing happens. When you talk to folks who are uninsured in Idaho, their shoulders are up here. There's just a different tension. We talked to these folks who happen to have Medicaid coverage because Montana had expanded, and they were much more carefree, much more able to attend to their children and things that they needed to in their everyday life, as opposed to feeling that anxiety and the weight of being uninsured.